Satellite Clinic now celebrates its third anniversary. In just 3 years, tremendous progress has been achieved clinically, in education and training, and through community and outreach work. Today, we would like to share our story with you. In partnership with the Government Referral Hospital, Satellite Clinic provides outpatient, inpatient and emergency care for the children of Sotnakham district, covering a rural population of around 300,000 people. Outpatient care is led by Dr. Sapal and includes new patients, follow-up patients and chronic patients suffering from illnesses such as epilepsy and asthma. In 2012, we saw a significant increase in patient numbers across all departments, but most notably in inpatient numbers by more than 50%. Clinically, 2012 was a challenging year with a dengue fever outbreak. It was long, starting in April, and is still continuing. We saw a very large number of patients seeking care at Satellite.
We had so many patients coming. We had more patients than we have bed. So we had to put some patients on the mattress and then floor. That's why our nurse and doctor work hard as a team to care all.
The second challenge was hand-foot-mouth disease and complications due to the EV71 virus. Again, staff rose to the challenge commendably and ensured the particular care and isolation needs of these patients were met in order to prevent the spread to others. Indeed, standards of infection control are something we are immensely proud of in Satellite. All departments have a critical role to play, but our brilliant team of housekeepers, led by Sreya and supervised by Somnang, really do set the standard and lead the way.
We all do the deep clean together every month in order to reduce the contamination of the bacteria to the patient and all the visitors in the ward.
Last year, we increased the number of alcohol dispensers to 1 per bed, and we encouraged caretakers to take their part in infection control by cleaning beds and feeding bottles thoroughly and washing their hands. Their understanding of the importance of hygiene and their commitment to maintaining these standards is vital. Also important to maintaining infection control are caretaker badges, which were created to help identify caretakers and also limit the number coming into the ward at the same time. Last year, some new staff joined our team, including a physiotherapist 3 days a week. Being able to provide multidisciplinary care is important, and the impact of physiotherapy together with clinical care should not be underestimated and can contribute to reducing the length of hospital stay. Last February, we partitioned part of the inpatient department to make a protected 4-bed neonatal area. The purpose was to improve neonatal care and also reduce hospital-acquired infections. And a mini-audit in May showed significant improvements and a reduction in infections as a result. Newborn and neonatal care represents a large part of our patient population, both in the inpatient ward and also in the emergency room, where many newborns come needing immediate resuscitation in order to take their first breath of life. The collaboration with the referral hospital delivery room has been strengthened considerably. They now call an emergency bell for at-risk cases that require immediate intervention. As a result, the outcomes for the newborns have improved, with a decrease in those suffering oxygen deprivation to the brain, something which has long-term clinical, social and economic consequences for the family. Other significant cases in the emergency room include trauma, sepsis, poisoning, pneumonia and burns. The vast majority of patients are successfully treated and cared for in Satellite, but approximately 20 to 25% of emergency cases are transferred to AHC for intensive care or trauma care. Unique to Satellite is our high standard of emergency ambulance transfer, which includes a doctor and nurse escort. Last year showed big improvements in this process through the creation of a transfer protocol and guidelines which ensure high standards are maintained and patient transfer is safe. Transferring a critically ill and intubated child is demanding, and the staff are again to be praised for their commitment to providing monitoring and care to the patient en route in the ambulance. Safe transfers are also critically dependent on solid teamwork across all departments. From the preparation and stabilization in the ER, the transfer team of the driver, doctor and nurse en route, and handover to the AHC team. Within the last 3 years, our partnership with Sotnakum Referral Hospital departments has developed significantly, with improvements in quality and availability of tests in the lab and in the X-ray departments, overseen by Dr. Samal. Training has been provided and standards improved in the lab and X-ray. Communication has been facilitated by an internal phone system and a monthly meeting of all the Sotnakum Referral Hospital departments, now including Action for Health Partners, Sotnakum Referral Hospital Management and the OD, making these meetings far more effective and productive. Sotnakum Referral Hospital Pharmacy has benefited from working closely with our pharmacist Chiva to ensure good pharmacy management is achieved. Our relationship with and work in the community is essential to the success of the project and is something that is achieved almost single-handedly by our dynamic community coordinator Sombat. Sombat liaises with Sotnakum Referral Hospital, the OD, PhD and the 23 health centres we cover, joining several of the health centre meetings every month. He ensures good communication and feedback between Satellite, the health centres, patients and the community, and works to resolve any issues necessary. Most patients have some level of social issue which will impact on their care, including poverty. Sombat works to solve these difficulties together with the Action for Health team, who provide patients with reimbursements for hospital expenses. Sombat is also great at assessing needs in the community, and as a result we achieved 2 successful outreach mobile clinics to remote villages in 2012. These were in partnership with the OD and local health centre and worked towards developing capacity at the local level. Education and training is a fundamental part of the Satellite project and has made huge progress in 2012. Satellite is becoming recognised as a unique training facility for doctors and nurses, including student nurses and now probationary doctors and nurses.
I can learn a lot in Satellite as there is a different patient population here and we work together within the government hospital and therefore we do not have all tests and x-rays always available, so I have to rely on my own clinical skills for more. In Satellite, I have the opportunity to practice and improve my clinical skills, which is the foundation of being a good doctor.
Education for patients and caretakers is an important part of the overall care we provide, and our nursing team provides teaching to patients and caretakers on the ward daily, on topics such as nutrition, hygiene and illness prevention. An education group of 6 nurses led by Unit Manager Bunchun was established in early 2012. He has coached and mentored the nurses to be a teaching resource of the future. They now ably demonstrate their skills teaching in service at the health centres and in Satellite. Education and training in neonatal care was identified as a specialist area of care that our clinical team needed. Through the support of Children of Cambodia Foundation and the NUHS team of Singapore, neonatal training occurs on a monthly basis. Through lectures, lunch case presentations and clinical teaching on the ward are all part of the program provided. Many of our regular lunch talks are given by visiting specialist volunteers who generously give their time, sharing their knowledge and expertise to inspire our staff. Some of the volunteers have been coming for many years. We also appreciate these volunteers for their clinical advice on specialist cases. A great example of such a success story, a boy from Mondulkiri, over 500 kilometers away, who had uncontrolled epilepsy. Indeed, prior to first coming to Satellite, he'd been unable to find appropriate treatment and was having seizures every day. He first came a year ago and Dr. Andre, a visiting neurology specialist from Canada, saw the patient together with our medical team and advised on treatment. Now, the child is seizure-free and has a greatly improved quality of life as a result. Satellite also takes pride in the way it can help improve the quality of life of its staff, in addition to patients. Sita, one of our security guards, learned about the importance of hygiene and nutrition through his work in the hospital. He took the information home, sharing it with his wife and 3 children. A small bonus was given to all staff after the dengue outbreak, and Sita invested it carefully, buying pigs. His wife began working as a cook, enabling her to bring home discarded food to feed them. After fattening, the pigs will be sold for profit and new pigs bought. And slowly this investment will gradually enable Sita to provide a better quality of life for his family. 3 years of satellite activities has seen the project develop and grow beyond expectations. Patient number increases, standards of quality care, leading the way on new clinical developments, cooperation with Suknakum hospital departments, education and training, extending our services to the community through health centre training and outreach clinics, and the progress and development of staff. The achievements have been both broad in scope and deep in quality. Ultimately, success is only possible with the vital financial support of donors, the time given by volunteers, the support from AHC, and most importantly, the commitment and dedication of our satellite staff. After all, it is their passion and enthusiasm which forms the backbone of the satellite clinic. We ask for continued support in order that the achievements we have made so far can be built on in the future, and even greater successes celebrated. For all of this, and so much more, we say a sincere and very grateful thank you.